IPN's the largest medical centre operator in Australia, about 220 medical centres all the way across all the capital cities and major regional towns of Australia. I'm the Chief Business Development Officer, and essentially that means I take care of all of the business growth aspects. Mainly includes acquisitions, new site development, our marketing alliances with other industry partners. We have about 1,800 in the network, about 1,100 full-time equivalents, but essentially that's about 9% of the GPs in Australia. Well, I suppose the main difference is the network. You know, by the time we have a business with the scale of ours, we're able to invest in infrastructure to improve things like IT, to do some pretty innovative alliances with health industry partners, and generally have a support network that's able to deliver new programs for doctors, which, you know, individual GP-owned practice wouldn't necessarily be possible. I think the biggest trend is going to be the increased number of GPs. They've doubled the number of medical student places in university, and that will actually begin to put an interesting spin on an industry that's essentially had an undersupply of doctors for many years. That will probably move towards a situation which the patient, making sure you have a large enough patient base is considered. That's probably the biggest trend. The second two are related. The first is the electronic health record. You know, it's a bit been pilloried in the market, and so far it really hasn't got very far. But a situation in the future where you can see that a health record is actually accessible by multiple GPs, by hospitals and by other health providers, where a patient has access to that health information, will make a really big difference to GPs. Thirdly, I think, not surprisingly, is internet technologies. You know, as simple as online appointments, but then what else can connected practice do for their patients? Video consultations, the way of the future. What other services could patients access from external to the practice that they currently have to go into the practice to receive? That'll be an interesting time. It's not something that's necessarily been in any way exposed as for the general practice market before, but it will come, and it'll be an interesting time for GP. Look, I think there's a little bit of a trend of, depending on the area, of patients moving away from private billing towards bulk billing, and depending on which side of the coin you're on, there can be a problem. The old chestnuts of bureaucracy, increased accreditation requirements, paperwork, those sorts of things, which really stop doctors from being able to be productive and see patients. If those things are in their way, they essentially can earn less, and all the downflow problems from that. Well, you wouldn't want to completely pigeonhole them, but I mean, I suppose that the first thing is that they're caring by nature. I think, you know, they get into that industry because they want to care for patients, and so you've really got to consider patient interests first, and that's really the key part about general practice, that it has that overlay, which is more than a typical business. I suppose the other point about doctors is caution. You know, they've had a lot of things happen to their industry over the last 25 years. Not necessarily all of them are very positive. And so with new things, they're cautious. There obviously are many exceptions to those personality traits, but you have to take into account the fact that for new things to occur, they need to be shown very clearly that A, it's good for patients, and B, that it won't, you know, unduly affect their day-to-day lifestyle. Well, I think in this day and age, the first element of success is group practice. I think we've learned over the years that you need enough doctors in your practice to make it sustainable, but also allow other doctors to cover your leave and to have a collegiate environment. Once you've kind of got a group practice environment, I think that certainly already, but certainly more important in the future, are the elements of a practice that make it attractive to patients. Access is really probably a pretty key defining phrase, not only access from a physical perspective, such as parking and public transport, but also hours. You know, how long are you open? What services do you offer during what parts of the week? Going down towards that, there are other patient-centric, your actual location. Is it well located amongst the community, and how do you sit? If you bring all those things together, you have a really thriving practice that has longevity. Absent a few of those, you might have some more risks. Look, I think the main risks going forward are to do with the number of GPs. If the number of GPs in Australia increases as we anticipate it would, you'll end up with more competition, and more competition for an owner of a GP practice with high cost levels and not a high margin often can really put a dampener on your earnings. And sustainability. So that's the main challenge. And so therefore, other risks are, what other providers are in the area, what other health service providers are trying to sort of get in on the GP market. Pharmacy, allied health have expressed a viewpoint. And look, the expectations of the patient is the other side of that coin. We believe that patients will come to expect more as they get more choice, and that will come in the form of patient services, mobile phone apps that connect to your practice, other in-practice services, better waiting room technology or facilities. There are a whole bunch of expectations that patients may have in the future that aren't currently delivered in a general practice environment. At the end of the day, the revenue generation from a general practice is the doctor. And so the only way that you're going to maintain profitability whilst getting service levels is to have that doctor best able to focus on seeing patients efficiently and well. And that's the combination of the profit and quality healthcare. So what it boils down to is allocation of roles. Do you have a good nurse that knows their role in terms of supporting the doctor in an immunisation clinic or a chronic disease management program? Do your reception staff know how far they can take the information collection at the front desk so that the doctor has everything they need when they first get started? If you have a well-oiled team of professionals that support the doctor to keep them productive, that's probably the key to maintain profitability. At the end of the day, that also allows the doctor to provide good healthcare. Well, I suppose at the end of the day, the growth comes in through new patients. So marketing, good reputation, patient services, patient education. Little seminars in the evening on key health issues. That engagement with the local practice will drive patient attraction and then retention. Ultimately, the other thing to do is to add doctors, and so having good facilities and having things that will attract other doctors, especially registrars. As I mentioned before, there's a lot of young doctors coming through. If you're a registrar training practice and their opportunities are opening up there, then you're getting young doctors coming in, and more often than not, they will stay in the practice that they initially come into. So if you can get patient growth and doctor growth all mixing through in a planned way, then you can maintain that growth level. The top one by far is doctor productivity. what does each doctor at the practice bill for every hour that they're at the practice? We concentrate on that as pretty much a key fundamental of our business, and look at that as a measure of how productive and how well our doctors are earning. It's a function of how much they charge and how many patients they see, and so if we have productive doctors, then we are ahead of the game to start with. The next element, quickly beyond that, is cost. And the largest cost component that you can manage is staffing. So the two KPIs which are fundamental to a business, and we will look at every time we look at a business, is the staff cost as a percentage of the overall income of the business, and a related one, which is the number of staff on for every doctor hour that's rostered. And if you can get those two, can be balanced in different ways depending on the type of practice, but those are key KPIs that drive our business. Getting down the level, debtors is important, obviously. But most practices are Medicare funded and they pay pretty quickly. It's not an inherently large part of the business. So if you get those KPIs managed, fundamentally, you've got a pretty good practice. You look at other things, but they're the main ones. There are two real sort of differentiating factors. One is transferability, and the other is longevity. If you've got a doctor with personal goodwill, really what that means is that a lot of people are attracted to them. They could go somewhere and people will follow, and there's inherently goodwill in that. The issue, though, is whether or not it's transferable and, in the same sense, long term. Compare that with practice goodwill, where you've got a good practice, it's got a name, people drive up to it every day. If you did move it with its name and its phone number and its fax number and its website address, people will still, and patient records, people will still keep calling that practice. It's long term, and it's able to be that goodwill is able to be transferred to somebody else. There is some grey area in between those two things, but ultimately, it is the unfortunate fact that many doctors think personal goodwill is something that they can inherently sell, but it's kind of attached to them. And unless they can sort of show what other assets they're bringing in that they can transfer across to a purchaser, that's where they can run into trouble from that definitional point of view. Good rule of thumb. Look, at the end of the day, it's a cash flow business. There's not a lot of capital requirements in a medical centre business. So we do cash flow analysis, which will look at a net present value of the future cash flows, those sorts of things. Say small practices, so the inherent rate of return is typically a bit higher. And then ultimately, you'll then look to an EBITDA multiple. It's a bit of a combination of all three, and if a centre has very good prospects and good longevity and future growth, then we'll build in some growth areas to the modelling. Ultimately, it's a small business. We don't value it any different to anybody else. If it's got the longevity and the future growth prospects, then it'll be valued much like any other business. Well, the obvious one is profitability, but I suppose the first thing we'll look at is its longevity as a standalone business. And so we will look at the number of doctors there, how long they've been there, what if there's a GP registrar program that's adding to the doctor's practice over time. Do we have a good patient base and a good location that's really tied to that practice? Those things, pretty long-term things, but they're the value, for us. Secondarily, we then start looking at how well they're running their practice, and that comes down to cost base. There is the element with most doctor practices that not all of the doctors are owners, so they have doctors on contract. What are the rates that those doctors on? Are they at market rate? If they're being paid over market rate, very difficult for us to, unlikely that they make good money, but also difficult for us in a situation to buy, because it sort of can affect the rest of the business. So you're looking at how well they've set up the fundamentals of the business, staffing levels, doctor levels, and then ultimately get down to profit. And you get down to is it making good money? Is it making good money even after the owner doctors have paid themselves? Those sorts of fundamentals. Historically, and probably many doctors still hand over their business to the younger doctors coming through. 80% of the market is GP owned, so that is very much a key part of the industry. Obviously, there's also sale, and in a related way across both of those is young GP registrars and getting them trained up. Depending on the size of the practice, you might want to just add 3 or 4 young doctors and then eventually just stepping away. Extricating value from a GP business has been very difficult for many doctors over the years, and so to be honest, sometimes it's just retirement with someone agreeing to take care of patient records. You kind of have to have that fundamental practice goodwill to be able to move it to somebody else if you're going to have succession with income coming out of it. The main point about our business model is that each GP in the practice is an independent GP, and so they each have an equal say in that sense. IPN as the practice owner is charged with making sure that we run the business, so ultimately the decision will come down to us. But the real point about it is that it's a business owner bringing its level of knowledge and experience from other practices where things have been successful and not successful, and bringing them into the doctors and convincing them that there's a better way. And so we'll have strategy sessions with all the doctors of the practice, and they will, all discuss the ins and outs of what this new idea is, and then ultimately we'll come up with a decision, which at the end of the day, if they've had a chance to participate in the decision making, they'll buy into it. Not always perfect, but it is it works for us, and most of the time we get good results. I suppose for us, the main one is to buy their practice if they're a practice owner. And typically the model that we employ is that we will buy that business and then they will work as an independent GP within that practice for a period of time. And look, that can be a succession plan in the sense that they will begin to reduce their hours and they eventually step away from the business. And for many reasons, that is a model that's worked for us over the years. A variant of that is that we'll do what we call amalgamation, which is 2 or 3 or more local practices coming into a new centre that we've bought, and we still pay goodwill payments for each of those practices because ultimately we're buying their business and relocating them into a new environment. Typically that will then also involve attracting other doctors that older doctors can hand their practice over to should they wish to over time, and ultimately they can move on into whatever phase of life they're looking to move into. By probably a fair way, accountants. We deal with accountants and lawyers and other advisors over time, and ultimately they're the most trusted because they're the ones that have the most long-term involvement with the GPs and help them make business decisions over time. A few of the things I've touched on today are pretty relevant. I mean, certainly being able to help them with looking at their cost base and staffing levels and taking a focus on that, which is often not something GPs look at very closely. The other area is probably investment decisions, because GPs who are working every day in the practice and sort of there for the long haul probably aren't quite ready at the end of every day to make a decision about an investment in new IT or new hardware or a fit out soft refurbishment or something like that. Whereas if an accountant can bring to them a decision-making pathway that allows them to see that this will actually add back to their business in the long term by way of value and patient flow and those sorts of things, I think that can probably really add value to a GP's lifestyle. And ultimately, the other areas around revenue increases, they can play a part in, and I certainly think that different accountants have different strengths in looking at ways of attracting patients and having marketing plans and that sort of thing if they want to be in that area, depending on the type of accountant, obviously. We're always looking to acquire good businesses. It's pretty much core business for us. So in the sense that we can help alliance partners understand the key fundamentals of our interest level and what we'd be interested in purchasing, there can be a real good conversation. Some of the things I've touched on today are relevant to what they can see about their client and maybe put forward. The other areas we can obviously talk about is areas in which we'd like to move. We're in most capital cities and most regional towns, but not all parts of those capital cities, and we have that view of having a network that's across Australia. So there are definitely regional opportunities as well. But ultimately it comes down to, I suppose, not wasting everybody's time, in the sense that we have a good idea. If we can give a good idea of what we're interested in, then accountants can quickly advise their clients that you might be a good prospect here for this type of opportunity. Have you considered that versus your other options? We keep that world of communication going, and I think a lot of accountants can get a lot of good work out of their GPs. The thing I might also add, I suppose, is that accountants, advisors keep a role with each of the GPs, because each GP still has their own practice, and they still need to do their own books. They don't become employees; they become independent GPs. So they still need to do their own books individually from now on, but they still retain that relationship with their GP, even though the actual practice ownership is handed over.